holds a Master's of Science in Nursing, majoring in maternal and child health. And also, she has a Master's of Project Planning and Management. She's been a lecturer for midwives for over 10 years. She'll take us through a topic on strategies for maintaining well-being during high-pressure situations. And this topic really speaks to us as nurses who are actually in the front line in healthcare service provision. Welcome, feel welcome, our able speakers. We will now move on to our first presentation by Mr. Onesmo Peter, and he will look at a topic enabling us to be able to identify signs of stress and burnout among healthcare workers, and also how to foster a supportive work environment to promote the well-being of healthcare workers. Mr. Onesmo, the floor is yours. Feel welcome.
Thank you very much. Looking forward to have you for the entire presentation. As you see on the screen, we start with the introduction through the statistics to see how the problem is that big or small. You will judge according to the statistics, because that's another way we can understand if the problem is big or small. But as you see, there are 4.7 billion people working. Among those, according to the World Health Organization, it shows 1 in 7 are having a challenge or going through mental issues. So you can imagine 1 out of 7. If you are at workplace, you count 1 to 7. Among you, 7 of you may be going through something related to mental health, so you can understand. But another research, world global, shows that 50% of all health worker professionals reported burnout. So you can imagine how many are you in your workplace. 50% of you, that means half of you, may be going through burnout. Another research shows that 4 in 10, 4 people out of 10 public health workers, and this is global also, going through burnouts. So you can imagine how the problem is. It's obviously big. So yes, let's go through and see what's the burnout and what is the stress and how to foster mental health at workplace. Thank you. So I will be going through the difference between stress and burnout through different aspects. For example, just to explain a definition, stress and burnout are kind of difference. So stress is for short time. So it can be because of the busy world or deadlines or workload, and you can feel the stress. In contrary, burnout is a bit longer. So you have it's a chronic state of or prolonged distress. That's when you get burnout. You see. So there are some characteristics which will identify this is stress and this is burnout. For example, physical signs. If it is stress, you may feel some headache, fatigue, muscle tension, even sleep disturbances. On your daily life, you may find experiencing such. Are you? Just assess yourself. That may be stress. But now, maybe you're already in burnout state. Let's see. When it comes to physical signs, you will have chronic fatigue, insomnia, increased illnesses, ashes, pains. So you may feel some pains or some illnesses from nowhere, and sometimes you go to take some test and don't get any challenge, you may be going through burnout. Back to emotion signs on stress, you will have some anxious or anxiety, irritability, feeling overwhelmed sometimes. You even have some memory loss or relapse. And those racing thoughts, thinking this and that and that and that. So those are maybe symptoms of stress, which you may be getting through at your workplace. When it comes to burnout, on the emotional signs, you may be detached or hopeless. You don't have hope anymore. Loss of motivation. You're not motivated anymore. You sometimes feel isolated. Or, I mean, you isolate yourself. You see, and you've been creative, but recently you just lost creativity. You're no longer creative. You wonder what happened. And of course, some delay or can't decide well, and making decision becomes a big deal, big issue. And you wonder why you were okay before, but now, yeah, something like that. When it comes to behavioral science, you will find to have avoidance, reduce the productivity, substance use, painkillers, and of course, this is very common to health workers. When you feel stressed or you feel hurt, is what you have been mentioning, you feel some headache, you feel burnout, and you think you will take painkillers will help you. And it happens that you misuse it, because every time you will be taking painkillers when you don't feel well. But it's not even the problem it's because of either burnout or stress. So those are symptoms of, are you feeling any of them at your workplace, even at home? This may be cause, we will see what our cause is. Yes, let's go to next slide, please. So yes, as I said, causes of the burnout or stress, long or unpredictable shifts. You know, you guys, how you work very hard, you have a lot on your table, and you are supposed to leave at maybe 3 p.m., but emergency comes, and you a lot of patients, and you can't leave the patient suffering there. You feel to support and help, and those may be because of stress and burnout. But also administrative overload. Some of you have some administrative and some other responsibilities, emotion demands, emotional labor from, you see, lack of control, insufficient resources, and this is very common, especially public hospitals, I mean, health centers, hospitals, whatever. Sorry. Family pressure. You have your own issues from the family, you bring it at work, and it will affect you. It may bring some stress or burnout. Financial stress, you know, guys, you get a salary, but sometimes not enough. So that can be a cause of stress and burnout. Stress from critical patient cases. As I said, you know how you are dealing with the very serious cases. As a person, you sometimes not able to handle it. It brings to stress or to burnout. Sleep disruption due to shifty work. You understand, you guys, because you are at workplace, you know how busy host or SK or whatever you may be working. Sleep disturbance is very common to health workers. High state of decision making, you have a lot of to make. You have some important decision to make, and those can turn to stress and burnout. Working with the stressed patients, yeah. So you know, everyone has their own issues. When they come at the hospital, they bring it to you, and that can cause the stress or burnout. Yes. Sorry. So let's see how are we going. How do we what do we do when we are having stress or burnout in school, in workplaces, or also healthcare or whatever? These are some of the recommendations. So you can have group the briefings after 2 tough cases, work-life balance. So you guys have to balance between the work and life. You have to have your own life. You have to balance your work. You have to balance other responsibilities. Otherwise, if you focus on one thing, it obviously will affect you. Flexibility schedule at work. Yes, there must be a flexible schedule that can also help to relieve the stress and burnout. Promote open communication, feedback, ability, trust. So this is a bit not common to workplaces. If you have something to share, you will keep it. You may not share to anyone, and that can cause stress and burnout. And you can't share what you are going through or what you think can be helpful. So that can be a problem. Peer support and mentoring programs, there must be some support groups. You see, access to mental health service, mental health resources, very, very, very important. Do you have counseling session, counseling culture in your workplace? Do you see psychologists? Do you have someone to support you emotionally at workplace? Are there psychologists employed within the settings? So they are very important. Can you have some technical support, mental health technical support? So that are very important. Adequate staff and avoid to overwork. Very important. Leadership that prioritize staff welfare, and this goes to direct to the our employees. So they must implement these. They must prioritize the staff welfare. Building support, yes. Psychological safety, also this is very important. Do you have time to share with your bosses? You know, there's this and this. Psychological safety is very, very important at workplace. I'm not sure how many workplaces are allowing or company are bringing this psychological safety issues. Very important. So another thing, mental health policies at workplace. Do you have policies at workplace? Do you have programs or something like that? So very, very, very important. Workshop on resilience, stress management and mindfulness. Do you have all of these things? Yeah, so very, very, very important. So here let's see the importance of addressing stress and burnout as well as positive impact on supportive environment. So the importance, there will be decreased risk of mental disorders and physical illness. There will be increased effectiveness. If there are effective handling of mental health issues, there will be increased effectiveness. Avoid errors. You know, when you are stressed and burnout, you may cause errors. So when there's implementation, obviously there will be some little error, if no, nothing. Reduce the absenteeism. Yes, you know, you guys go home because of stress and burnout. Increase the care quality. Yes, patients will be cared in a right way, rather than to be cared by a patient, by a nurse or doctor having stress and burnout. Lower turnover. Yes, some people will stay at job rather than leaving. Low cost. Yes, increase the workplace moral. Enhance the mental health and the job satisfaction, improve the patient care and safety. Those are factors caused by improving mental health mental health at workplace. Next slide, please. Yes, so just ending on my part by telling you that you must spot early signs of stress and burnout in yourself, and of course, to colleagues. identifying some symptoms area, it will help you to seek help. And of course, taking care of our mental health workers is not an option. It is essential. And let's lead the change together. So thank you very much for listening, and make sure you identify the symptoms of burnout and stress. Thank you very much.
Thank you. Thank you so much, Mr. Onesmo, for that introduction. And it is important from that conversation to note that we are being told that among the working population, 1 in every 7 have a mental health issue. So for us as healthcare workers, we need to be cognizant of the signs and symptoms of stress and burnout, so that we can be able to identify them early and be able to take precaution early and be able to take care of ourselves and our colleagues. Thank you so much, Mr. Onesmo, for that introductory part. We will then move to the second presenter. I just want to remind us, if we have any questions, please type them in the chat. We will pick them and we'll be able to respond to them at the end of these presentations. Our second speaker is Dr. Lilian Shundi. And after going through the introduction and being able to go through the signs and symptoms of stress and burnout, we are now going to go through the self-care practices. We've been told we need to be able to identify those signs in ourselves and even in our colleagues at our workplaces. So what are some of the self-care practices that we can be able to use and apply at our workplaces, so that we can be able to promote mental health among us and our colleagues? Welcome, Dr. Lilian. This is your session. Feel welcome.
Asante. So before moving to the self-care practice that I thought is important to have the statistics or to understand, the concept of stress. Can you hear me well? Can you hear me? Hello?
Yes, we can hear you clear.
Yes,
Yeah.
we can hear you. We can hear you.
Okay.
Go on.
Okay. So according to DSM-5, stress is defined as an emotional and physical response to pressure. So this occurs when an individual lacks the ability to cope due to limited resources. You know that feeling of feeling under pressure. You have so much to do and limited time to do. So when we talk about the resources, external resources means something like getting help from others, and it can be equipment. So particularly for nurses, when you're working on the wards, it depends whether you're a general nurse, whether you're mental health, but you need the equipment in order to work that, blood pressure machines and things like that. So if you don't have enough resources, external resources, that can be a main contributing factor for stress. So, and when we talk about internal resources, this include your own personal resilience and strength. So thank you so much, Dr. Onesmo, for explaining well, the concept of resilience and stress and strength. So when you don't have enough internal resources, resilience and strength, that as well contribute to stress. But having said that, a certain degree of stress is necessary for human functioning from the psychological point of view. Because can you imagine a life without any sort of stress? It's going to be boring and it won't be motivated to do what you're supposed to be doing, such as, waking up early in the morning. So what makes you wake up in the morning? Because it's just a little stress and anxiety knowing that if I don't get up on time, I'm going to miss, I'm not going to get to work on time. Or sometimes fulfilling other life responsibilities and also maintaining relationship with others. So a little bit of stress is important. So when we're talking about stress in this context, we mean the chronic stress stemming from one's job or occupational. And it is important to talk about this because it's present a significant challenge that impact individuals across different sectors, including people who are self-employed, people who work in organization or volunteering. And we're talking about worldwide. So it doesn't matter whether you're in the US, UK, China, Australia, Tanzania, whatever. So it's a major health concern. So according to statistics, it is projected that 12 billion productive days are lost due to illnesses, mental health illnesses such as depression, anxiety, and stress. And this is actually amounting approximately 1 trillion US dollars per year in loss of productivity. So this is WHO 2024. But I think we will talk about that maybe some other time. We can recommend to do our own research in the region of like East, Central, South Africa, whatever, to know how much people really are impacted by stress. So now, when we talk about stress, what is contributing to stress? It can be negative working environment, characterized by discrimination, inequality in heavy workload, limited job autonomy, job insecurity, and all these things can cause mental health. I mean, particularly stress. When we talk about job discrimination, it doesn't mean whether you're black or white or Chinese, but even discrimination in let's say, I mean, by the way, I am experienced nurse as well. My background is also a nurse, even though I have other things I'm doing. So when we talk about discrimination, when there's no fairness at work, other people are given like little workload when others are giving more work to do, and people are not listening to. This is what I mean by discrimination. And inequality as well. So it's related to that. There are people, especially when you work so hard. Do you understand? Have you seen that on the wards where if you're hardworking, always on time, on all that, people are kind of over relying on you. Therefore, you're having a huge workload. That sometimes it can be our own psychological problems, such as a people pleaser concept. So I'm talking from the psychological point of view. So limited autonomy and insecurity and all that. When we talk about job insecurity, you're not guaranteed whether you're going to keep your job or not, especially in private hospitals where, they sort of prioritize profit rather than, increasing the number of people or the working load really. So they put more pressure on staff. Yeah. Okay, let's move there. So yeah. Okay. Now, why do we have to talk about healthcare workers? Because everybody experiences stress really, right? So the reason we're talking about healthcare, these are very very essential people in the society. We are very important people in the society. And so helping them to manage stress is very, very important. Right. Now, when we talk about stress management strategies, we're going to talk from the psychological point of view. So first of all, we need to understand the factors that causing stress and how to address those individually. Yeah. Can we move? So before we discuss the strategies to managing stress, it is essential, as I said before, to identify what it means, what is maintaining that, to identify indicators. So indicators means, it involves cognitive, emotional, and physical and behavior symptoms resulting to stress. So Dr. Enesmo has spoken a lot about some of the, manifestation of stress. How do you know this person is stressed? What is burnout and all that? But I'm just going to say briefly. So the interplay between cognitive, emotional, and physical symptoms to manage stress, we call that the vicious cycle of stress. So which means if you're experiencing negative thoughts and a negative emotional, and the physical manifestation of stress, which has already been discussed. So the interplay between these two, it maintains something we call the vicious cycle of stress. So which means this becomes ongoing, right? So if it's not addressed, that becomes an ongoing issue, and then people get diagnosis of that. So now, in order to manage stress, we need to identify what are the triggers. So to manage stress effectively, it's crucial to recognize the triggers and find a way to cope with them. So now some of the manifestation or some of the reasons it can include, or some of the it can include complicated family relationship, financial difficulties, heightened workload, pressure, adjustment to change, and all that. So this can be some of the contributing factors. And once the triggers identified, so it is essential for healthcare workers to communicate to their employers and seek assistance. So again, as what Dr. Esmo said, so sometimes just it is important to seek support. So we have the occupational health department, which can offer support such as psychological therapy, psychoeducation, or resources that can be helpful really in understanding the triggers for stress. So for healthcare workers, I think it is important now to understand what are the self-care practices that one can use to manage or to alleviate stress or to enhance resilience and strength. So one of them is actually talking about good physical health, promoting good physical health. When we talk about physical health, something like engaging in regular exercise of activities. Now, this can be debatable where like, oh, we haven't got enough time, we're doing long hours, but exercise doesn't mean climbing mountains or anything. You can actually incorporate exercise while, at home or something. You don't need many hours. So exercise is important, and having a balanced diet as well. So I can imagine doing 12 hours of shift where you only have, let's say, I don't know, just a cup of tea. So balanced diet is very important. And then sometimes taking some supplements as well. This has become a very common, even in Africa, people take supplements, multivitamin and all that. And routine medical checkup as well is important. There are so many nurses actually just dying, and because we don't actually look after ourselves. So, and during working hours, it is quite important to take breaks as well as sufficient sleep. Now, taking breaks there can be challenging because, when you work on the ward, it's 24 hours, isn't it? You see patient coming in and out. And then sometimes if you're not assertive, so again, the use of assertiveness, you need to understand your body will tell you that I'm tired, you need to take breaks. Because the way to think about it, that 1 hour break that you're not taking, the employer is not paying you for that. So you're not ignoring, but taking regular breaks is very important. And again, sufficient sleep is important. So, right, okay. So managing workload. Managing workload is very important. So this gives you, something like planning your day, prioritizing your task, delegating work as part working as a part of the team, and seeking supervision. Acknowledging the areas where you're lacking knowledge, and then to do that. So regular training in the skills is very, very important. And in social network, this is very important, but I think we're doing very well, like in Africa, in comparison to other areas of the world, such as the UK and all those places, because people work so hard and you don't get them to socialize. So now, socializing is very important where you connect with other people, because when you're isolating yourself, you come from work, on your off days, you just sleep, you don't talk to people, that can really create a difficult environment. So making effort to connect with family and friends and community. Most people go to church and mosque and all that, and that's very important. So, okay, can we move to the next slide? So now, relaxation and mindfulness, what do I mean? Relaxation and mindfulness is staying in the current moment and acknowledging and enjoying what you have, despite having, let's say difficult work and all that. But you can always find something interesting to do on your own, like yoga, going to the gym, doing workout, walks, and whatever it is. The activity that you can do alone. So, which means giving yourself permission to have fun. Everybody's got what they enjoy doing. So that's very important. So yeah, so those are the kind of just examples there. And yeah, moving the slides really quickly. Okay. Yeah, relax. So we spoke about giving yourself permission to have fun and relax. So that's important. Fine. So we can move to the last slide now. Okay, so one of the most important thing to manage stress is having the right support and resources. So Onesmo and myself in Tanzania, we try as much as we can to provide, like resources for corporate. Psychoeducation is very important, like especially for nurses, you need to have, that kind of support. So make sure when you have the webinar or any presentation you attend, so you can learn some strategies and also to identify the early signs of stress. So, well, thank you so much for giving us opportunity for MyRise International Mental Health Foundation, where we have a lot of resources and techniques to manage. So, asante.
Thank you. Thank you so much, Dr. Lillian Shundi. We have a call to action at the end of your slide there. Dr. Lillian is telling us to always remember that we cannot pour from an empty cup. So as healthcare workers, we have the rest of the patients and families and communities relying on us in terms of supporting them, providing care. But we cannot be able to effectively provide quality care if we are not taking care of ourselves. So you cannot pour from an empty cup. Taking care of yourself is a professional responsibility. It is a professional responsibility for you to take care of yourself so that you can be able to provide quality care and be able to support the patients who actually rely on you. Thank you so much, Lillian, Daktari, for that presentation. We will now move on to our third speaker, Dr. Bupe Mwamba. And we are glad that you are able to join us all the way from Australia. I know it's very late in the night. Thank you for creating time for this session. She'll take us through strategies for maintaining well-being during high-pressure situations. Welcome, Dr. Bupe.
Thank you very much, Madam Moderator. Okay, so welcome to the last presentation of the day. And so we're going to reflect on high pressure situations which have an impact on our well-being as nurses and midwives. And so we need to know and be able to adopt strategies that help maintain good mental, emotional, and physical health during such times. And we need to embrace compassionate care of ourselves. So looking back at the two presenters that have already presented, they've touched on a lot of important aspects that we need to embrace as nurses and midwives. And one aspect that we should know is that because we are nurses, most of us, if not all of us nurses, we are very compassionate. And so each time that we find ourselves in situations where we need to help another person, we are likely to have what we call compassion fatigue. So we need to understand that everything that we do as nurses when we're working can lead us into having compassion fatigue. And so we need to know and find ways of trying to maintain a balance between the environments that we work and even our own personal lives. Because looking at the first presenter, he actually mentioned about having family pressures. So this afternoon, I was having a conversation with high school students, and one of them asked me about how we navigate life as nurses and midwives whenever we have situations, because even as you get to work, we are going to work from our families. And so the question was, how do you manage handling other patients when you're coming from a family that has somebody who is not well as well? Like, for instance, if you have a sick parent suffering from hypertension or stroke, and then you are going to the hospital to take care of other patients if you're a nurse or in whichever position that you are in. And so how do you manage to navigate life like that? And so I had to go through the cycle of compassion, what we do as nurses. And so one aspect that I mentioned is that we need to identify strategies for us to be able to manage those situations. And most of the time when we go for work, there are certain times when we have high pressure situations that push us so far with regards to our well-being. And so it's extremely important to embrace different strategies that will help us navigate life, both from family pressures and high pressures situations that we encounter at work. Okay. Yeah, and so we need to recognize the stress symptoms which have already been alluded to. And so we need to know by now, I'm sure everybody of us knows our bodies better. And so whenever you're feeling emotionally drained from being compassionate, so remember, every time that we are helping patients, we may develop what we call compassion stress. And so when compassion stress is not well managed, it can get into compassion fatigue. Just like when you look at stress and burnout, we can also have that continuum where we move from stress, compassion stress into compassion fatigue, because we want to solve out or to sort out every problem that we encounter, or we want to help every person that comes to us with issues because of our empathetic nature. So being empathetic most of the time is also what we call can be a burden, because each time that you are in a situation, you always want to help out people. And so that can actually drain you. And so we need to have ways and means of ensuring that we are managing. And so we need to know that sometimes when we're not feeling 100% fine, we have anxiety, or we are irritable or depressed, we don't want to get involved in other activities, or sometimes we may be physically fatigued, having sleepless disturbances, and all the other signs and symptoms of what I alluded to earlier. So we need to know what that entail with regards to recognizing stress symptoms. And then we can also have behavioral changes. You just withdraw from everything else that is happening, and all of that can point to our burnout and mental health issues that we are facing. And so we've already been informed about ways and means of how we can move into an environment where we are able to be mentally well, or we practice what we call mental hygiene. So it's very important to ensure that we embrace what we are learning today and what we've already been presented to us. And so very, very important to ensure that we identify what we like doing. And so for me, I always tell people that one thing that I came to realize early in my life is that to unwind from anything that has been stressful, like in the week, I usually go shopping, even if I'm just buying a pen, or whatever I buy will just make my life happy, and I'll feel like, I've unwinded from the things that were holding on to me. So everybody of us should be able to identify things that we like doing. And if it means like singing or cooking or going to church, being involved in activities that will make us unwind from those moments where we've had a lot of pressure, is extremely important as we navigate life as health professionals. Yeah, so all of these things have already been alluded to, and ensuring that we are having at least 6 to 7 hours, 6 to 8, not even 6 to 7, 6 to 8 hours of rest if possible. It's extremely important for us to be able to recover from the stress that we had encountered in our work. Yeah, so those are the things that we need to do. Yeah, and again, social support, social capital is extremely important, as earlier mentioned. And I think other aspects that we need to start doing, especially in low and middle income country, is building support groups. So where people can have time to just unwind or debrief. And so another aspect that we also need to start doing, especially in high pressure situations, is having moments where we can talk through or debrief. So if we have any supervisors or any leaders on the webinar, ensure that debriefing is commenced as soon as possible. So whenever there's a high pressure situation at work, ensure that staff have somebody that they can talk to debrief out of their situation, for them not to get into compassion fatigue and even burnout, which very, very detrimental to our bodies. And so we also need to remember that we need to provide staff or professional help. For instance, we need to have what we call employee assistance programs, where a staff can seek help free of charge if they need counseling, if they need to speak to a psychiatrist or psychologist when they can't handle the mental health issues that they're experiencing from either burnouts or from compassion fatigue. It's just important for organizations to provide that. And then we also need to have family members that are supportive, and even colleagues, because colleagues are even able to understand situations that other fellow colleagues are going through. So for emotional support, it's very important for us to embrace that. And then we also need to be kind at all times. I always tell people that you don't need to know somebody for you to be kind to them. So whenever we are practicing some level of kindness, it's something that is beneficial to us and even to the person that is receiving the kindness. Yeah. Okay. And then we also have time management. And one aspect that is extremely important, especially when we're talking about compassionate fatigue, that which most of us health workers usually experience, is that we need to have to manage our time properly and ensure that we are prioritizing tasks and setting realistic goals. And this means saying no when we feel like we've had so many tasks, or we've had so much on our plate and we can't just be helping everyone, because that is detrimental to our own health. And so always remember to take your break. Don't say that, no, we've been busy, so I haven't had time to have my tea break or my lunch break. Take those unpaid breaks so that you can recover from the stressful environments, and celebrate small wins. Clap for yourself. Don't wait for people to clap for you. Whenever you do something or you achieve something that you had planned, make sure you're clapping for yourself, and use tools like calendars and to-do lists to ensure that you are staying up to date with everything else that you want to do. And then I'm sure most of us here people that are able to pray. So find time to pray and unwind from events that may have had issues on us. Yeah, so then practice self-care and pamper yourself. Like take yourselves out, even if like you may feel like, no, how can I spend this much going to Livingstone to go and see the Victoria Falls? But it's just important because you can only give what you have. And so if you are bent out or if you have compassion fatigue, you can't be as productive as you can if you had no bent out symptoms or compassion fatigue issues. So always remember to practice self-care. Okay. Yeah, then in conclusion, it's just important to maintain a well-being during high pressure situations, which requires a proactiveness approach to care. And so knowing and recognizing that you are really stressed at a time is something that is very important for you to be able to seek help. So don't just sit in your own square. When you are not feeling fine, make sure that you seek help so that you can move out of that stressful situation that you have landed in. So just remember that being a health worker, a nurse, and a midwife is something that can actually lead to mental health issues, because when we're talking about empathy, we're talking about us people that have chosen to be helping people. And so that is not just something that we live like it's a gown that we wear when we go to the hospital, but it's something that is just within us. So even when we see other people needing help that are not even patients any help, we always want to jump in and help. And so you keep on helping people, and in the end you end up having compassion stress because all you want is to respond to anyone that needs help. So always remember to set limits to whatever you're doing and to take care of yourselves to prevent compassion fatigue. Okay. All right. So the call to action with this is to ensure that you build your well-being plan for high pressure moments by being resilient and ensure that you are uh, not feeling pressurized by whatever situation that is happening. Because when you're stressed or burnt out, even a simple issue may become exaggerated because you are not able to look at the situation that is happening, but because you're already overwhelmed with other things that you're experiencing. So ensure that you're building resilience. And so I always tell people that resilience is built through things that happen in our lives, those things that we may feel like, how did I even move out of this, when you felt like it was something that was too big to handle. And so how you move out of those situations can either build or break you. And so most of the time, when you come out with a positive attitude, for instance, what we call when life gives you lemons, you add sugar to make lemonade. That is building resilience in itself. And so those are aspects that we need to embrace and ensure that we are building resilience whenever we have situations that are high pressure at work. Okay, so we have 18 points for you to take home with. And so number one is prioritizing restorative sleep. So always take your 6 to 8 hours of sleep every day as a nurse and midwife. Commit to regular physical activity. And so activity means even just taking steps, like you set your steps, like you're going to be doing 10,000 steps per day. Make sure you're able to maintain that, and then a nutritious diet. Then engage in professional mental health support. So seek help whenever you're not feeling fine. Then have digital detox. So what we're saying with regards to this is that take time off social media. Just have your me time with no phone. Like behave like it was in the days when we had no smartphones. And so find time to do that every day for good mental hygiene. Then keep a journal. So write things down. Every day, take a reflective journal of what had transpired at work and everything else that happened. And then reflect on that as you are writing. Then practice mindfulness and meditation. Then reconnect with nature. So take time to walk around the greens. I always call the surroundings that are natural, that is extremely important for mindset and our mental health. And so set health boundaries. So ensure that you are able to say no where you cannot extend your help, or where you feel like you have had so much on your plate and so you can't just keep on giving out. You also need time for you to recover. Then organize and declutter. So it's very important to ensure that your houses or your places where you're staying are well organized. And so once in a while, just declutter, remove things that you're not using, give out things that you haven't used in a long time. And that also helps with good mental hygiene. Then number 11 is sunlight exposure. So take time to walk in the sun. So vitamin D is extremely important, and it also improves on our sleep patterns. So take time to walk around. Then monitor your social interactions and the needs that may be arising so that you're not having so much on your plate to prevent compassion fatigue. Then cultivate supportive relationships, which are extremely important for our social capitals cannot be overemphasized because they are extremely important. They are people that help us navigate life every day. And then indulge in reading. So read something, get books if you can. If you don't have, read the Bible or the Quran. So find something to read to keep yourself busy and updated with some of the things that you would want to learn. Then indulge in personal care, take scheduled vacations. So I know that sometimes vacations may be too costly, but find time to even visit people that are within your vicinity, like somewhere where you can just take one bus or where you can drive to if you drive. Then build compassionate cycles. So make sure you start building your compassion cycles where you can meet and just talk about high pressure situations that you had as nurses and midwives, for you to be able to debrief in those cycles. So it's something that can be done in every hospital, and you can be having maybe weekly or monthly meetings where just talking about how to navigate a life and its challenges. So because even when we are going for work, we are going there from families. And so there are a lot of things that can be discussed in compassionate circles, looking at everything else that we as nurses and midwives will carry and all of that. And then organizations to provide employee assistance programs. So it's a call to every organization to ensure that nurses and midwives are given a listening ear by providing employee assistance programs where midwives and nurses can have free access to counseling and psychologists and mental health specialists to talk about issues that are affecting them. Thank you very much for listening.
Thank you. Thank you so much, Dr. Bupe, for that important presentation. And I like what you have shared with us in terms of what we can actually do, get involved in to ensure that we improve our mental health. We are going to move to the question and answer session. And I just want to start us off. I had requested that we write our questions on the chat so that we can be able to respond to them. I think I've only seen comments so far. And there was only one question. One of us wanted to know whether we are going to share the presentation. Yes, I have seen the Secretariat has responded that you are going to get the presentation. So this question, I'm going to throw it to all our speakers, maybe for them just to comment. I have read somewhere about mental health among healthcare workers. And one of the main issues that is coming up is that we could be having stigma preventing our healthcare workers from seeking care. What is your comment on that? Thank you. Any of our speakers can pick it up?
Yes, let me pick up to give a comment on stigma. Just to be clear, what's going on, just to give an example in my country, Tanzania, stigma is a very big issue, very big thing happening in Tanzania. And of course, around the world, and specifically Southern East Africa. So stigma is almost everywhere, almost to everyone. So if you jot out some of the groups, including nurses and health workers in general, yes, it is a very big issue, stigma. That's why you find very people seeking help, seeking counseling, because they will be stigmatized. Okay, are you going to a counselor? Or are you yeah, they will start naming those names, instead of supporting him, helping him, as if someone was feeling not okay and someone will tell him, go out, go to hospital, but he can't or she can't tell him that go to a psychologist, go. You find the stigma around. So they will stigmatize you to the extent that you will stigmatize yourself and you will not seek help. And so another side of stigma comes to people who are going through psychological issues or mental disorders. So if you find someone struggling with mental disorder, they will be stigmatized. And there are these words like, is bewitched or is cursed or is, there are those words stigmatizing him or her, and that can cause him not to seek help, not seek support. So stigma is a very big issue, a very big problem, and that's what makes mental health not being prioritized. Instead, there are so many disorders which would be avoided if there was no stigma. So what we do as advocates is to educate the community, the society, to psychoeducate, to provide mental health awareness, to make sure that, when you are going through something, just seek help. And like Dr. Bupi said, all of those, you can do it. So stigma is a very big issue in our societies and cause many problems. And some people don't go to seek help. Instead, they go to churches, they go to Sangoma, which I don't know, they call them witch doctor, I don't know which kind of doctors, to see if they can be helped. It's because they can't seek help, psychological help, because they will be stigmatized. So yes, when back to nursing and other healthcare providers, they don't seek help because of stigma. That's true. Yeah, anyone can also comment on that.
Thank you. Thank you so much. Any comment from the other two presenters briefly?
Yeah, I quite agree with what Onesmo said. I think what is lacking is the definition itself of mental health. So in Kiswahili we say kichaa. So I think when you talk about mental health, people have that image of like someone who is really let's say in a critical stage, like walking on the streets, dirty and all that. But I mean, mental health is an umbrella term. It can mean even something like stress is mental health, or depression, which is very common. But due to lack of understanding or psychoeducation, that's when people think the moment you seek counseling, there must be something wrong with you. And therefore, people go to church to be prayed for. But some of the problems we have, it may be sort of maybe lack of assertiveness, for instance, in marriages and all that. So I think what will be important is to continue, educating the society really about mental health, so we could to tell the difference, really.
Okay. Thank you, Dr. Shundi. Do you have any comments, Dr. Bupe, about stigma and its impact on healthcare workers with regard to seeking care?
Yes. So I think maybe now that I'm in Australia and it's very different here, and there isn't much stigma because people are able to talk freely about mental health issues, or if somebody is having mental health issues, they can actually seek help and all of that. But again, looking back where I'm coming from, which is Zambia, I think stigma is still there. And so we need more sensitization. And we need people to know that mental health is just like any other illness that somebody can have. And so when they are having those moments where they are not feeling themselves, it's important to seek help. And so I think what we need, especially in low and middle income countries, is sensitization with regards to mental health and the importance of seeking help. And that is what is going to remove the stigma surrounding mental health, because it's just an illness that can happen to anyone. And because of the changes that happen in life, like you have those moments where, like for instance, for us who are health workers and we are very empathetic, we are likely to have compassion fatigue, which can lead to mental health issues because all you want is to help everybody. And so you can't keep on helping people. You also need help yourself. And so we need to know that compassion fatigue can actually lead to very serious mental health issues if not managed properly. And so it's from such talks that we can build on advocacy with regards to mental health and as health-seeking behaviors that we need to embrace as health workers. Thank you.
Thank you. Thank you so much. We have a question on the chat. from Ordinator Majegeta. How can we approach the colleague when you find signs of stress which is not related to work? For example, a colleague has family issue but looks stressed at work. Sometimes it's difficult to talk to a colleague about mental health issues, even other illnesses. Any one of the speakers can pick that, can respond to that. How do we help a colleague who has signs of stress?
I think first of all is to normalize the experience. When I say normalize, to help them to develop insight that this is a problem. Now, in Africa, I'm not sure if like let's say the occupational health, because when you have occupational health, which means this is a department that really help to look after health for the healthcare workers. So now, if there is such a department, then it's good to make a referral because like when you're concerned about mental health for everyone, I think anyone can make a referral for a colleague to suggest that. Again, so it's a question of stigma. So that's why I think normalizing the experience to say, well, I have noticed that, you're coming in late or you're isolating yourself, you're crying, what is going on? And to try and offer support as much as you can,
Okay. Thank you, Dr. Shundi. Do you have any rejoinder, Dr. Bupe?
That's very interesting. So I'm just wondering, because if a colleague is not fine and we like if you're in good relationships with that colleague, it will be easier to start up the conversation with regards to the "Are you okay?" conversation. I don't know if we have the "Are you okay?" conversation in our settings in our hospitals now in Africa, because that's how you begin a conversation when you have to navigate somebody who is looking like they're having issues. So if you ask them, "Are you okay? What has been happening? How is your family?" And then somebody will be able to open up. But if we can't even talk about "Are you okay?" as a strategy to ensure that people are opening up, I think it makes it very, very hard for us to navigate those difficult conversations. So it just starts a conversation with regards to building our relationships with each other at work starts with the "Are you okay?" question. So "Are you okay?" is part and parcel of our mental health strategies at work. So all you do in the morning whenever you go is asking, "Are you okay?" And then you sit to interact. So you don't just ask a person and say, "Hi, are you okay?" and move on. No, it has to be, "Are you okay? How is life? How is the family? How is work? What is it? Is there anything that is bothering you in the conversation that you're having?" So probably we need to embrace the "Are you okay?" Theory at work as
Gotcha.
well. Yeah,
Okay.
thank you.
Good.
Thank you. Thank you so much, Dr. Bupe. I think we'll carry that with us. We need to adopt "Are you okay?" approach at our workplaces. And it's not just "Are you okay?" and you move on. You need to probe more to be able to understand exactly what your colleague could be going through. There is another question here from the registrar, Elizabeth Oyuer. She'd like to know if there are countries with care of carer programs. Do we have countries with care of carer programs? Dr. Shundi?
What does it mean, care of care program? Can you what do you mean care
Well,
of
there's
care?
more.
No, I can explain.
Do we have yes, okay. Dr. Bupe, pick it up.
Okay.
Yeah,
Dr.
so
Bupe?
yes, so care of carers are usually programs that people that are caring for patients, not just nurses. So it's for everybody. So we also have like relatives who are carers of people that are sick, isn't it? So at home,
Yes.
like for instance, if you're managing your mom as a
Yeah,
carer,
carer, yes.
yeah, you're a carer. And so there are those groups where you can enroll into, which are carers group, support groups of some kind,
Oh,
where
support,
people can
yeah,
have,
support.
yeah, those spaces where you can talk about issues and the government also. So carer of care is like a paid position. So if I have somebody who is sick in my house, I can register with the government and they can be paying me for caring for that person, because that's
Yes,
the duty of the government to do that. Yeah, so I don't think we do have carers of carers in Africa,
in
and it's
Africa, not
something that
yet.
needs to be established. Yeah. And the situation
Okay.
analysis can be as undertaken so that we can show to say actually there are no carers of carer support groups that people can enroll into, because caring for people is really something that is mentally draining, and
Mm.
if you're not the one that is affected, you may have somebody who is affected and you are the carer, and so we need those circles where we can go and talk through and just debrief. Yeah, thank you.
Okay, thank you very much. When I look at the chat, we basically just have comments, and most of the comments there appreciate that today's topic is a very important topic. We have just initiated a conversation in this area that no one wants to talk about. And we are hoping that this will not be the end of this conversation. It should be the beginning, so that
Yeah.
we can be able to even identify strategies to take care of our healthcare workers. At this moment, I want to return the session to the Secretariat. Julius? Julius? Okay. If Julius is
Hello,
not,
can you hear me?
hello. Yes, Julius, I've
Okay,
returned the
thank you so
session
much.
back to you.
Yeah, thank you so much, Dr. Damaris Ochanda, our moderator, and our speakers as well. I saw the today webinar has been interested to majority of the participants, and I like the take-home message from one of the speaker that don't say, "Are you okay?" and then you end up there. You should dig it deeply. In Tanzania, we have we normally say habari, and then you proceed. So how are you asking someone how he's doing, and then you don't wait, stay and wait for the feedback? Why did you ask if you are not interested to know indeed about it? So thank you so much. So the next part before the vote of thanks, which will be given by our registrar, Madam Elizabeth. I just want to remind the participants, as we normally give the certificate of participations to the attendees. So there are those who joined direct, not from IECO. Actually, we recommend you to join from IECO platform so that we can keep your records clear, so that when we evaluate for the time you attended, you participated in the webinar, you should get the certificate. If your rate of attendance is above 75% of the webinar time, which is 90 minutes. So for those who joined directly via the link which was offered to the group, please check me by sending the email to info@exacom.org. I wrote on chat. You can just send the email there, write your name, and say that I have been a participant to the mental health webinar. Then I will just respond to you accordingly. Just indicate your full names, and then you will get that certificate. But if you join directly from the IECO, don't worry, because your details are there. We'll just track the participation's details, and then we will share the certificate accordingly if you meet the requirements of getting a certificate. So checking out here, our next webinar will be, before I welcome Madam Registrar for finalization, our next webinar will be about combating maternal and the neonatal mortality. Also, it will be the evidence-based approach from the practicing midwives. So they'll just give us about the combating maternal and the neonatal mortality. And if you check in the IECO, it addresses the key topics to be addressed, which is to review the review of maternal and neonatal mortality trends in ECSA region, evidence-based strategies and intervention to reduce maternal and neonatal death, key barriers to improving maternal and newborn health in ECSA region, the role of healthcare systems, training, and the community engagement in preventing the deaths, as well as collaborative effort and the policy framework for sustainable impact. So we welcome you to attend the next webinar, as I indicated there. So saying so, we will also put the discussion topic to proceed within IECO platform, but we want to welcome you also to give your feedback within the platform. If you open the platform well, you can see there, this is the number of those people who participated in the previous webinar. Up to now, 119, and they are coming from almost 25 countries. I hope you can see it here. They are coming from 25 countries. United States, we have from the Spain, we have the participant from Germany, we have from Norway, and almost India, Malaysia, and almost all countries of East, Central, and the Southern Africa. So we welcome also others from the North Sea and even other part of Africa to come and
March to
join us.
25
So
April.
thanks. So I want to welcome Madam Registrar for the vote of thanks, and the record will be added. Webinar record will be added in our YouTube account so that you can even go through later. Welcome, Madam Registrar.
Thank you so much, Julius, for those very kind words. Thank you for the updates. I want to thank the presenters today. They have been wonderful. They have given us practical tips. So it is up to us to go back, reflect, and see what you can start doing tomorrow. Actually, care of carers is a big thing. Guys are suffering. COVID taught us that people are suffering. They are looking after patients, and when they go home, they themselves are really in a big mess. And we can start by doing some studies or even observations where we work. How many people are missing work because they are fatigued? How many are going to the ropes? And there are very many. So as mental health workers, let's be alert. Let's support each other. Let's care for each other. And let's just take these tips seriously. I've taken them so seriously. I want to go one by one and evaluate at the end of the year what have I done. So thank you so much. We are taking note of this. Other seminars that are coming, and please make sure that you attend. They are very informative. To the rest of us who have attended, we also are very, very grateful. I know my internet is not nice, but the ones who have attended, thank you so much. I know we were very many. I didn't even expect that, but we want to be very, very grateful. Grateful also to the moderator. Today we have kept time. For the first time, I'm speaking at 6:30, at 4:30 Kenya time. Wonderful. Thank you so much for the beautiful moderation. And with those very few remarks, we just want to say kwaheri ya kuonana, meaning it's a goodbye, but we'll see you soon. We'll see you soon in this forum. In the meantime, may the Lord bless you, may He keep you, and may He make His face shine upon you. In Jesus' name. Amen.
Asante.
Thank you.
I think they should.
Asante sana. Thank you so much. And
Thank you. Thank you.